Like most patients headed for major surgery, Luis Coriano had some anxiety.
So I rather call you.
Registered nurse Julie Witschke and physician assistant Abby Myers were determined to put him at ease.
I kind of wanted to alleviate those fears for him.
They are great.
You were actually very brave about that.
A fairly rare genetic disorder had created some tough choices for Luis and his parents, Manuel and Nitza. In fact, they traveled from Puerto Rico to Mayo Clinic in Rochester, Minnesota, trying to find a solution.
We search in the internet and we find that there are not many places to treat this condition of Luis.
So Luis came to us with a condition called familial adenomatous polyposis. Patients with this gene defect develop multiple polyps or growths in their colon. This is a view of the inside of his colon, and he's got over 1,000 of those little polyps. Every single patient with this disorder will get cancer, and many patients will die from the cancer if we don't do what we call a prophylactic surgery.
That meant removing Luis's entire colon. Living with the after effects of that worried him far more than the operation. So his Mayo team tackled Luis's concerns one by one.
If we don't do some type of internal reconstruction, a patient will have to bring their intestine to the outside of their body and empty their stool into a bag.
Abby knows exactly what that involves. Because she's had a comparable procedure, she could reassure Luis it would not limit him in any way.
I told him, you know, I will take care of you in the hospital after your surgery, but right now I'm just going to be a person that you're meeting that has been through something similar. And so you can ask me anything.
You know, he also has a learning disability. Functional autism, I believe, was his diagnosis. Kind of became like his male mother or his older sister or whatever you want to say. Went to the operating room with him, and I stayed with him until he was fully asleep in the operating room.
Then Dr. Douda went to work, finding a way to reconfigure Luis's gastrointestinal tract so he would only need the stoma, an external pouch, temporarily.
The standard procedure is what we call the ileopouch anal anastomosis. Now, once the colon and rectum are gone, what we do is take the small intestine, fold it on itself, and bring it down to the deep pelvis, and that creates this reservoir where the patients can hold their feces and then evacuate naturally.
Dr. Douda says this works for 95% of patients, but Luis's internal anatomy wouldn't quite reach.
And it's actually the blood vessels that sometimes restrict us in getting this pouch to go all the way down in the deep pelvis.
So he performed a complex technique that preserved and lengthened the intestine's critical blood supply.
So it's a technique that I would say is done in very few places around the world. It's a procedure that we do maybe once every 10 years, and in his case, it worked beautifully.
Quality of life is really important to all of us.
It was very much a team approach for Luis, and we do that for a lot of patients.
That's what makes us special.
And he was just a great patient to take care of. I mean, he was so overjoyed and so appreciative of, you know, the opportunity that he had to avoid this permanent stoma. I have this entire team that's caring, considerate, very talented, and they do it every single day.
For the Mayo Clinic News Network, I'm Dennis Douda.